Hello everyone. Today in the subject of medical microbiology, we are going to study about the bacteria known as Streptococcus. So in this lecture, we are going to give you a brief introduction about Streptococcus, what are its various types and how uh, it is differentiated following various classification methods, and what are the diseases and their cure and steps that are necessary required to be taken in order to cure the disease. So, you will be able to understand the mechanism of bacterial pathogenesis very clearly in case of Streptococcus. So, Streptococcus is a genus of gram-positive coccus and plural cocci, right? So, a coccus-shaped bacteria, they are round in shape and they are arranged in shape of balls, right? And if there are more than one, then they are known as cocci or spherical bacteria that belongs to the family of Streptococci. So they have a different family. It is known as Streptococci, right? So it has to be noted that it is a coccus shaped bacteria and it belongs to the family of Streptococci. Within the order Lactobacillales or lactic acid bacteria in the phylum Firmicutes. So, this also belongs to the phylum Firmicutes. Cell division in Streptococci occurs along a single axis. So, as they grow, they tend to form pairs or chains that may appear bent or twisted. So basically, the streptococci is a bacteria or the bacteria that is having a coccus nature. So it is generally observed in cocci that they tend to grow along the single axis, right, in a series. And as a result of that, they form pairs or chains, and sometimes that appear to be bent or twisted in nature. So physically, they are just focus. Focus is arranging itself again and again and forming a long chain. Right. This differs from staphylococcus, which divide along multiple axes, thereby generating irregular grape-like clusters of cells. So, on the other hand, if you take example of Staphylococcus has its own nature, right? In contrast to a Streptococcus bacteria that grows in the form of coccus and it multiplies along the axis. Staphylococcus multiplies with the multiple axes and thereby leading to the generation of grape-like clusters of cells. Okay, so Staphylococcus also means that grape-like structure. Most streptococci are oxidase negative and catalase negative, and many are facultative anaerobes. So, what is the meaning of facultative anaerobe? Capable of growth both aerobically and anaerobically. So, it does not mean that they certainly require oxygen for their growth, but they can certainly survive in the presence and absence of oxygen. So it does not matter that much for the growth of bacteria. So here are few points that we have considered. Like Streptococcus belongs to the genus of cocci, right? And they are spherical in nature. They grow along the axis. That is why uh, they are also from the phylum Firmicutes, and they tend to appear bent because of their multiplication pattern. And in their counterpart, Staphylococcus, it divides along with the multiple axes and does not have any particular growth pattern. So it appears to be a grape-like structure, right? and they are oxidase negative and catalase negative. Many of them are facultative anaerobes, but they are also capable of growth both aerobically and anaerobically. So, because of this, we can easily see some of the main features of Streptococcus bacteria that are generally seen and generally observed by the microbiologist or medical microbiologist. So, here in this slide, you can easily see the shapes of bacteria, right? Staphylococcus aureus appears to be in clusters and grape-like. Streptococcus pyogenes, they appear to be in a series, right? And diphtheria, it just appears to be scattered. Neisseria gonorrhea appears to be small clusters of coccus, right? Streptobacillus moniliformis appears to be twisted chain, and Vibrio cholera appears to be kidney kidney beans like structure. So, as you can see that every bacteria has its own morphology, right? Why? Now the question arises: why these bacteria they have such a different type of structure? Although bacteria they multiply asexually, but how come they have evolved into such a different pattern and such a different working mechanism? The correct answer is that as the bacteria were progressing and along with the time of evolution, they underwent some changes or mutations. And the bacteria who have mutated, right? They it kept on copying itself. Okay, it kept on copying itself. So, following that scenario, the whole new species of bacteria was formed. Although normal bacteria are already there, but these mutated or totally different type of bacteria that are pathogenic in nature also uh, got their chance to evolve themselves because bacteria is just copying itself. Uh, one will form two, two will form four, four will form eight, eight will form 16. So this is a process that is always working in continuation. So if you want to see a bacteria growing, you must realize that they do not reproduce sexually; they mostly reproduce asexually, right? And if a bacteria is having some sort of mutation or some sort of changes, uh, it will keep on copying itself. Okay, once that mutation takes place, it will keep on copying itself, and it will never correct itself, but rather keep on copying itself, and it will lead to the formation of a new family of bacteria. It might be having a different working mechanism. It might be having different working procedure. It might be having a different pathogenic nature also. So this is how all these things they particularly matter a lot in the long run, right? So uh, that is why the shape of bacteria are so much different in nature. The term streptococci in 1877 was coined in 1877 by Vanessa surgeon Albert Theodore Billroth. He lived from 1829 to 1894. By combining the prefix "strepto" from Ancient Greek and Romanized "streptos" means easily twisted, uh, plaint, together with suffix "coccus" uh, from the modern Latin "coccus" form, Ancient Greek, Romanized means grain or seed or berry. So, which means if we translate this word according to the ancient Greek, it will mean a series of twisted grains. Okay, so here you can see the gram staining of Streptococcus pyogenes in the image, and you can see that it appears to be grain-like. Okay, and simultaneously they appear to be very twisted. So, in 1984, many bacteria found a group in the genus Streptococcus was separated out uh, into the genre Enterococcus and Lactococcus. Currently, over 50 species are recognized in the genus. So, the genus of Streptococcus, they carry about 50 species that are different from each other in this uh, genre. So, this genus has been found to be part of salivary microbiome, right? Because it is normally found in the microbiota, right? And it normally resides in the throat and salivary microbiota of humans. So, what we have learned here is that in the year 1877, uh, the surgeon of Venice surgeon Albert Theodore Billroth gave the term streptococcus. Strepto means twisted in Roman and Greek, and coccus means grain. So this bacteria, it appears to be twisted like grain, right? And there are more than or approximately 50 species that are found to be in this genre. And here in this image, you can see its structure under the light microscope, how they appear, and they do appear like grains, and they do appear twisted in nature. Now, in this image, you can see in the short form, like Streptococcus. Basically, it is a gram-positive bacteria. Colonies are zero point 0.5 to 1 mm circular in nature. Okay, their colonies are circular in nature, low convex, pinpoint, semi-transparent, matte, glossy mucoid. So, what does it represent? That the colony that these bacteria are forming, although the bacteria that we were observing in the image before were separated out from the colony. So, when bacteria it grows on an artificial medium, it grows very differently, right? So, when you are culturing the bacteria, there is one or two bacteria. Then, further they enhance their population when they say media is available in vast number and everything is up to the mark. Temperature is also good. The food is available. Everything is available. Then they slightly try to increase the number, and they form the clusters and groves in which they grow. So the colonies are the structure where the bacteria grow, and generally their colony is zero point 0.5 to 1 millimeter in shape, size, and circular and low convex pinpoint. From the convex, a low convex formation is there, and pinpoint is semi-transparent in nature. They appear to be very matty and appear to be glossy, a little bit shiny like mucus. Okay, and they have a very different uh, nature also, right? Like alpha hemolysis, viridians group, beta hemolysis, hemolytic streptococci, and gamma hemolysis, and Pterococcus uh, faecalis. So they do have a very different nature when they form bacterial colonies. Pathogenesis and classification. In addition, streptococcal um, pharyngitis or strep throat, certain streptococcus species are responsible for many cases of pink eye, meningitis, bacterial pneumonia, endocarditis, erysipelas, and necrotizing uh, fasciitis. That also means the flesh-eating bacterial infection. So it has a huge variation. from strep throat to flesh-eating infections also. However, many streptococcal species are not pathogenic and form part of the commensal human microbiota of mouth, skin, intestine, and upper respiratory tract. So, what they are explaining here is that not all the species of Streptococcus family are lethal or pathogenic to the humans. Many of the bacteria are the part of human microbiota. Not all of them are very dangerous in nature. Streptococci are also a necessary ingredient in producing uh, emmentaler or Swiss cheese. So they are also used for the biotechnology purposes and especially for the purpose of Swiss cheese production. Species of Streptococcus are classified uh, based on their hemolytic properties. Alpha hemolytic species cause oxidation of iron in hemoglobin molecules with red blood cells, giving it a greenish color on the blood agar. So, Streptococcus species of bacteria are also classified on the basis of the way they react with hemoglobin or blood, right? They have especially have hemolytic properties, which means they do react with blood and do some lytic effect, means with some hemoglobin breakdown effect, and it is the part of their property. Okay, it is a part of their nature. Like alpha hemolytic species cause oxidation of iron in hemoglobin molecule. So, as you know, the function of hemoglobin molecule is to carry out um, oxygen from lungs to the other cells that are present in the body. So, when streptococcus is there, it will readily uh, oxidize the iron in hemoglobin molecules with red blood cells, giving it a greenish color on blood agar. So they will readily oxidize hemoglobin and form a green color. Right. Beta hemolytic species cause complete rupture of red blood cells. Right. So what they are explaining here that alpha hemolytic species they readily break down hemoglobin. Right. And beta hemolytic species, what they especially do, they completely rupture the red blood cells on blood agar. This appears as white as clear of blood cells surrounding the bacterial colony. Okay, so it can readily be seen that alpha hemolytic streptococcus species it readily oxidizes the iron that is present in hemoglobin and turns blood agar turns the blood agar green in color, right? So on the other hand, uh, beta hemolytic species they also rupture, they damage the RBCs that are used in preparation of media, and on the blood agar it appears as wide area clear of blood cells surrounding bacterial colony. On the other hand, gamma hemolytic species causes no hemolysis. So in the family of Streptococcus, what we have observed that alpha and beta species or the members of family of Streptococcus, they do have a hemolytic property. Okay, alpha does the hemolysis of hemoglobin and beta does the hemolysis of red blood cells. But gamma hemolytic species cause no hemolysis. If you see Streptococcus bacteria of gamma hemolytic nature, then they are not going to cause any hemolysis. So, how, what you see here is an explanation of a term like Streptococcus pyogenes. So, what is the meaning of this? So, strepto means chain, coccus means round grain like, and pyo means pus, and genes means forming. So, uh, in simpler terms, you can explain that uh, it is a chain around bacteria that has a nature of pus form, okay, or a group of strep gas, Lansfield classification, and they have many different sort of classification that we are going to study as we are going to proceed in the topic. So here you can easily see the in the diagram also, uh, the Streptococcus bacteria appears to be in a chain of rounded coccuses that are slightly twisted. They are not at all present in a straight line. So this is the main thing that they are focusing on, and this consideration has led to many different presumptions and assumptions of classification that have helped a lot when it comes to identification of such pathogens. Okay, but it has also been observed that Streptococcus bacteria are also a major part of human microbiota. So, in the long term, they do not cause any disease, also, right? And they also help in the uh, Swiss cheese formation. So, it does have a spectrum that is very much helpful, also, and that is extremely harmful, also. So, beta hemolytic streptococci are further classified by Lansfield, grouping a serotype classification that is describing specific carbohydrates present on the bacterial cell wall. So different scientists were explaining different classification. The 21 described serotypes are named Lansfield groups A to W, excluding I and J. This system of classification was developed by Rebecca Lansfield, a scientist at Rockefeller University. In the medical setting, the most important groups are the alpha hemolytic streptococci, like Streptococcus pneumoniae, and Streptococcus viridine group, and beta hemolytic species of Lansfield group A and B, also known as group A strep and group B strep. So, what they're trying to do is to simplify and exemplify the different uh, categorization of streptococcus. So here you can see the whole table, like Streptococcus pyogenes. Its host is humans. The disease is pharyngitis, cellulitis, cellulitis, and uh, erysipelas, right? And Streptococcus agalacti. The host is human and cattle, neonatal meningitis and sepsis, because and Streptococcus digalacti and host are human and animals. The disease is endocarditis, bacteremia, pneumonia, meningitis, respiratory infection, and S. galolyticus, humans, and the host are humans and animals, and disease they cause is a biliary or urinary tract infection, and Streptococcus aeruginosus. Host are humans and animals. Disease is subcutaneous organ abscess, meningitis, respiratory infection, and Streptococcus sanguinis. Host are humans. Diseases are endocarditis, and dental caries. So, Streptococcus suis, the host are swine, and diseases they cause are meningitis. And Streptococcus mitis, the host are humans, and diseases are endocarditis. Streptococcus mutans, host are humans, and diseases are dental caries. And Streptococcus pneumonia, host is human, and disease is of pneumonia. So, this table readily elaborates the different species of bacteria of Streptococcus family that are pathogenic in nature, and what are the type of host they prefer, and what type of diseases they significantly cause in their host. So, with the help of this table, you can easily understand the main difference between the species. So here we are on the classification of Streptococcus. So Streptococcus oxygen requirement, right? So when it comes to the requirement of oxygen, aerobes and facultative anaerobes, right? Obligate anaerobes are also there, like uh, Peptostreptococci, but we are going to focus on anaerobes and facultative anaerobes. Their main character is stick is hemolysis, that is breakage of blood cells and uh, hemoglobin. So the main nature is alpha hemolytic, beta hemolytic, and gamma hemolytic. So what are the things that they perform? Alpha hemolytic, the viridians group, classified into species by physiological and biochemical properties. So their physiological and biochemical properties are essentially observed under this group. Beta hemolytic, the hemolytic Streptococcus. Serological grouping, polysaccharide C. 20 Lancefield group A, B, C, D, E, F, G, H, K, L, M, N, O, P, Q, R, S, T, U, V. And group A is Streptococcus pyogenes. When it comes to gamma hemolytic uh, group, what we see the Enterococcus group classified into species of physiological and biochemical properties. Classification of Streptococcus. Classification on the basis of oxygen requirement. Brown's classification on the basis of hemolytic pattern on sheep blood agar. Sherman's classification on the basis of physiological characteristics. Lancefield classification on serological basis or serological classification and biochemical classification. So they have ordained their classification pattern, or they have designed their classification patterns on different things. So classification based on oxygen requirement like aerobes and anaerobes. Is growth on blood agar, alpha hemolysis that leads to incomplete hemolysis, green in color, strep viridans, strep pneumonia, right? So anaerobe, peptostreptococci, uh, gamma hemolysis, alpha beta no hemolysis, and enterofacialis. And beta hemolysis, what we observe that complete hemolysis, Lansfield grouping, C carbohydrate, uh, Ag on the cell wall, group A to U, 21 groups, and Griffith typing of group A on MTR protein into more than 100 types. Classification basis on the basis of oxygen requirement. Aerobic or facultative anaerobes. For example, Streptococcus species and obligate aerobes like Peptostreptococcus. Brown's classification on the basis of a hemolytic pattern on sheep blood. So Browns also gave a classification of streptococcus. So here we see the three group: beta hemolytic, gamma hemolytic, and alpha hemolytic green. So beta hemolytic clear like pyogenes and agal agalacti. Group A like uh, bacitracin sensitive, and group B is bacitracin resistant. And when it comes to gamma hemolytic, Enterococcus like Enterococcus faecalis and Enterococcus faecium, and gamma hemolytic that significantly um, construct a green color, pneumonia and viridians. When it comes to pneumonia, optogen sensitive, bile soluble, capsule, and Quillan positive. So mutants like uh, sanguis, optogen resistant, not bile soluble, and no capsule. So first is alpha hemolysis group. Form incomplete hemolysis on blood agar, shows greenish discoloration around colony and persistent of some unhemolyzed RBCs. Streptococcus pneumonia, Viridians streptococci. Beta hemolysis group forms complete hemolysis on blood agar, give 2 to 3 diameter zone of hemolysis. Streptococcus pyogenes hemolysis group does not cause hemolysis at all. Non-hemolytic group does not cause hemolysis at all. These are non-hemolytic group. Streptococcus faecalis. Kerman's classification on the basis of physiological characteristics, like pyogenic streptococci, Streptococcus pyogenes, lactococci. They are mainly found in dairy products. They are non-hemolytic group like Lactococcus uh, Enterococci. They are normal flora of human intestine like Enterococcus viridians, Streptococci. They are normal flora of upper respiratory tract of humans. Blanchfield classification, it is also known as serological classification. So, what are some essential features? Streptococci has been classified into different groups according to the Lancefield classification. Group A, Streptococcus pyogenes. Group B, Streptococcus agalacti. Group C, Streptococcus equisemitis. Group D, Enterococcus. Other groups E to U. Streptococci are classified into many groups from A to K and H to U, one or more species per group. Classification based on uh, C carbohydrate antigen of cell wall. Groupable streptococci A, B, and D are more frequent in nature. C, G, and F that are less frequent in nature. Non-groupable streptococci. Streptococcus pneumonia causes pneumonia. Viridian streptococci, for example, Streptococcus mutans, that particularly causes a lot of dental caries in humans. The classification is based on the difference in structure of cell wall carbohydrate, that is, group specific polysaccharide antigen. Most strains of the beta hemolytic group and some strains of alpha hemolytic and non hemolytic group are classified on the basis of cell wall polysaccharide. Streptococci are classified into 20 Langsfield groups from A to V, except I and J. Group A, Streptococcus pyogene. Group B, Streptococcus agalacti. Group C, Streptococcus equi, and Group C, Enterococcus, and other Group E to V. Group A, Streptococci, that is Streptococcus pyogenes, is further subdivided into approximately 80 serotypes by Griffith according to their specific surface protein M, T, and R. M protein is the most important one. The pathogenicity of Streptococci depends on the presence of hyaluronic acid, capsule, and surface of M protein. So these are some important features that are considered. Biochemical classification on the basis of sugar fermentation test. Streptococcus ferments most sugar with production of lactic acid but no gas. Accumulation of lactic acid in media terminates bacterial growth. Streptococcus pyogenes do not ferment ribose and they give PYR test positive. On the basis of production of certain enzyme, on the basis of antibiotic susceptibility test, on the basis of colony characteristics on different media, on the basis of hemolysis pattern. So these all things are usually done or the test done in order to uh, classify them according to the biochemical nature. Virulence factors. Many streptococci elaborate virulence factors including streptolysins, DNase, hyo- hyaluronidase, and which contribute to tissue destruction and spread of infection. Few strains release exotoxins that activates certain T cells, triggering release of cytokines, including tumor necrosis, factor alpha, interleukins, and other immunomodulators. The cytokines activate the complement coagulation and fibronolactic systems, leading to shock, organ failure, and death also sometimes. Streptococci are gram-positive aerobic, anaerobic organisms that may cause many disorders, including pharyngitis, pneumonia, wound and skin infection, sepsis, and endocarditis. Symptoms vary with the organ infected. Sequelae of infection or sequel of infection due to group A beta hemolytic streptococci may include rheumatic fever and glomerular and enteritis. Most strains are sensitive to penicillin, but macrolide strains have recently emerged. Classification of streptococci. Three different types of streptococcus are initially differentiated by their appearance. They are grown on sheep blood agar, like beta hemolytic, alpha hemolytic, that we have already elaborated. Gamma hemolytic streptococci. Subsequently, the classification is going on, and we have already discussed these terms. Disease caused by streptococci. This is the one of the most important segment. The most significant streptococcal pathogen is Streptococcus pyogenes, which is a beta hemolytic and in Lancefield group A and is thus denoted as group A beta hemolytic streptococci GABHS. The most common acute disease due to GABHS are pharyngitis, skin infection. In addition, delayed non-suppressive complications like rheumatic fever, acute uh, glomerular nephritis sometimes occur in less or more than 2 weeks after infection. GABHS can spread through the affected tissues along the lymphatic channels, causing lymphoma. lymphangitis to regional lymph nodes causing uh, lymphadenitis. GABHS can also cause local supportive complications, complications such as uh, peritonsilla abscess, otis media, sinusitis, and bacteri- bacteremia. bacteremia. Fluctuation depends on the severity of infection and the susceptibility of tissues. Other serious GABHS infections include septicemia and uh, pu- puerperal sepsis and endocarditis pneumonia and uh, emphysema. The disease caused by Streptococcus species is less preventable and usually involves soft tissues infection and endocarditis. Some non-GAVHS infections occur predominantly in certain populations. For example, group B streptococci in neonates and postpartum grooming. Streptococcus pharyngitis. Streptococcal pharyngitis is usually caused by GAVHS. About 20% patients present with sore throat, fever, and a beefy red pharynx and a purulent tonsillar exude. The remainder have less prominent symptoms, and the examination resembles that the viral pharyngitis. The cervical and submaxillary nodes may enlarge and become tender. Streptococcal pharyngitis can also lead to peritonsillar abscess. Cough, laryngitis, and stuffy nose are not characteristics of streptococcal pharyngeal infection. Their presence suggests another cause, usually viral or allergic. An asymptomatic carrier state may exist uh, in as many as 20%. Scarlet fever. Scarlet fever is uncommon today, but outbreaks still occur. Transmission is enhanced in environments that result in close contact among people, for example, in schools or daycare centers. Scarlet fever is predominantly childhood disease, usually follows pharyngeal streptococcal infection. Less commonly, it follows streptococcal infection at other sites, for example, the skin. Scarlet fever is caused by group A streptococcal strains that produce an erythrogenic toxin, leading to a diffuse pink-red cutaneous flush that blanches with pressure. The rash is seen best on the abdomen or lateral chest as dark red lines in skin fold. They are also known as Pestia lines or a circumoral pallor. The rash consists of characteristic numerous small 1 to 2 mm papular elevations, giving a sandpaper equality to the skin. The upper layer of previously reddened skin often desquamates after fever subsides. The rash usually lasts for 2 to 5 days. Diagnosis of streptococcal infection. How these infections are diagnosed. Culture sometimes rapid antigen tests or antibody titers. Streptococci are readily identified by culture on a sheep blood agar. Rapid antigen detection test that can detect GABHS directly from throat swabs are available. That is a point of care use. Many tests use enzyme immunoassay, but more recently, uh, tests using optical immunoassay have become available. These rapid tests have high specificity more than 95%, but vary considerably in sensitivity, 55% to 80 to 90%. For the near optical immunoassay test, uh, thus positive results can establish the diagnosis, but negative results, at least in children, should be confirmed by culture. Because streptococcal pharyngitis is less common among adults, and adults are unlikely to have post streptococcal complications. Many clinicians do not confirm a negative rapid screening result in adults by culture unless the use of a macrolide is being considered. In such cases, cultures with susceptible testing to detect a macrolide resistance should be done. Demonstrating anti-streptococcal antibodies in serum during convalescence provides only indirect evidence of infection. Anti-streptococcal antibody tests are not useful in diagnosis acute GABHS infection because antibody first develops several weeks after GABHS infection begins, and a single high antibody titer is more likely to reflect a long antecedent infection. Antibodies are most useful in diagnosis of post-streptococcal disease, such as rheumatic fever and glomerular arteritis. Anti-streptolysin O (ASO) and anti-deoxyribonuclease B or anti-DNase B titer begin to increase about 1 week after the GAVHS infection and peak about 1 to 2 months after the infection. Both titers may remain elevated for several months even after uncomplicated infection. Titers are measured in acute phase and convalescent phase 2 to 4 weeks later. A positive result is defined as more or less than two-folds increase in the titer. A single titer greater than the upper limit from normal suggests an antecedent streptococcal infection or high streptococcal uh, endemicity in the community. The ASO titer increases in only 75 to 80% of infection. For completeness in difficult cases, any one of the other tests can also be used. Penicillin given within the first 5 days of symptomatic streptococcal pharyngitis may delay the appearance and decrease the magnitude of ASO response. Patients with streptococcal pyoderma usually do not have a significant ASO response but may have a response to the antigens. So, test for streptococcal infection, usually penicillin, pharyngitis. Ordinarily, pharyngeal GABHS infections, including scarlet fever, are self-limited. Antibiotics shortens the course in young children, especially those with scarlet fever, but have only modest effects on symptoms in adolescents and adults. However, antibiotics help prevent local suppurative complications, otis media, and rheumatic fever. Penicillin is the drug of choice for pharyngeal GABHS infection. No isolates of GABHS has shown penicillin resistant clinically. However, some streptococcal strains appears to have in vitro tolerance to penicillin. The clinical significance of such strains is unclear. Penicillin and beta lactam are contraindicated. Choices include uh, clindamycin 600 mg, that includes 6.7 mg per kg for children orally every 8 hours. Erythromycin and clarithromycin 250 mg, 7.5 mg per kg for children orally 12 hours for 10 days. Erythromycin 500 mg, 15 mg per kg for children once a day for 5 days. Because resistance of the GABHS macrolides has been detected, some authorities recommended in vitro confirmation of susceptibility if a macrolide is to be used and there is macrolide resistance in the community. uh, Clindamycin 6.7 mg uh, uh, per kg orally after 8 hours is preferred. In children who have relapses of chronically tonsillitis, possibly because of the following: clindamycin has good activity against penicillase producing staphylococci or anaerobes, co-infecting the tonsillar crypts, inactivating penicillin G. Right. So we must see the amoxicillin and other options also to treat the disease. And single injection of benzathine penicillin G6 100,000 units IM for small children less than 27 kg, and 1.2 million units of IM for children weighing more or less than 27 kg. Adolescents and adults usually suffice. Oral drug may be used if patient can be trusted to maintain the regime required for 10 days. Choices include penicillin 500 mg orally every 12 hours, amoxicillin 50 mg once a day for 10 days, uh, oral narrow spectrum cephalosporin are also effective and can be used unless patients have anaphylactic reaction to penicillin. Azithromycin can be used for 5-day course of therapy, although macrolides are inactive against Fusobacterium necrophorum, a common cause of pharyngitis in adolescents and adults. Delaying treatment to 1 to 2 days until laboratory confirmation increases neither the duration of disease nor the incidence of complications. Sore throat, headache, and fever can be treated with analgesic and antipyretics. Aspirin should be avoided in children. A blood rest and isolation are necessary. Close contacts who are symptomatic uh, or have a history of post-streptococcal complications should be examined for streptococci. So, skin infection and that causes cellulitis is often treated without doing a culture because isolating organisms can be difficult. Thus, regime effective against streptococci and staphylococci are used. For example, one of the following may be used: diclooxylenine and cephalexin. If methicillin-resistant Staphylococcus aureus (MRSA) is not likely, TMP or SMX, linezolid and minocycline, and clim- clindamycin if MRSA is suspected. Necrotizing uh, uh, faci- fasciitis should be treated with intensive care unit. Extensive, sometimes repeated surgical debridement is required. A recommended initial antibiotic regime is beta-lactam. Although streptococci remains susceptible to beta-lactam antibiotics, Animal studies have shown that penicillin is not always effective against a large bacterial inoculum because streptococci are not rapidly growing and may lack penicillin binding proteins, which are target of penicillin activity. So, other streptococcal infections like for treating group B, C, and G infections, drug of choice are penicillin, ampicillin, and vancomycin, cephalosporin. Right. So these are the MCQs. Which of the following sign of infection? Fever. Which of the following is an example of non-communicable disease? Food poisoning due to profound bacterial toxin in food. During an oral surgery, the surgeon nicked the patient's gum with a sharp instrument, and this allowed Streptococcus, uh, a bacterium normally present in mouth, to gain access to the blood. As a result, the patient developed bacterial endocarditis, an infection of heart. Which of these diseases iatrogenic? Which of the period is a stage of disease during which the patient begins to present general signs and symptoms of prodromal? A communicable disease that can easily be transmitted from a person to person uh, is which type of disease? A. Contagious. Which of the following is a pathogen that could not be identified by original cause postulates? Is HIV, human immunodeficiency virus. One of the advantages of combining vancomycin with linezolid is less nephrotoxicity. The most common pathogenicity of pneumonia is microaspiration of upper airway secretion through inapparent aspiration. The traditional approach of anti-pseudomonal drugs combination is anti-pseudomonal beta-lactam and aminoglycoside. A major factor that increases the resistance of gram-negative bacilli is both A and B. Prior to the use of broad-spectrum antibiotics, immunocompromised person. These are the references from where we have collected the material. And thank you very much for listening to my lecture.